In this film, I'm going to take you through how to actually perform CPR, but we're also going to discuss why you perform CPR. What you will notice in this video is that I'm only going to be talking about chest compressions. We're not going to go through mouth to mouth, and that's because it's been shown and proven in many, many studies that chest compression only CPR is still really effective. In fact, it's been shown that the thought of having to perform mouth to mouth whilst performing CPR has been the sole reason why people just don't start. So this training film is going to be in line with what the emergency call handler will ask you to do. They won't ask you to do mouth to mouth, they will just talk you through chest compressions. First, let's have a recap just to see where we've got to. So you've already performed your doctor's A, B, C. You've called 999. You've placed your phone on speakerphone, you've put it on the floor, so you're now hands-free. When you call 999, the emergency call handler is going to need some specific information. Firstly, arguably most importantly, they need to know your exact location.
Okay, what's the address of the emergency?
If you happen to know it, that's great, you can just give it to them. If you don't, again, keep it simple. Look on your phone, go on Google Maps, or even better, download the app What 3 Words.
Is the patient breathing? Is the patient awake? Tell me exactly what's happened.
Next, they're going to ask you about what has happened and the patient's condition. Because you've already gone through your doctor's A, B, C, you have all this information to hand. You know that they're unconscious and you know that they're not breathing. The call handler will then ask you if you know CPR and you're going to say yes. But if you do need a bit of a reminder, don't panic, they will guide you through it. That call handler is going to stay on the phone with you until help arrives. So let's step back a bit now and actually talk about why we do chest compressions. Don't worry, this is not going to be a biology lesson. Again, keep it simple. Your body is made up of an electrical and a pressurized plumbing system. It's as simple as that. Your heart being the main pump. The heart, or the pump, has stopped working. It's at this point that you need to step in and you need to do the work of the heart by performing chest compressions. Okay, so let's get back to our scenario. You're on the phone to the 999 emergency call handler. They've instructed you to start chest compressions. You have to think about what that means. Your heart is in the center of your chest. It's protected by your rib cage. Now that's fantastic, but what it does mean is your chest compressions are really physically demanding. You're trying to maintain blood circulating around the body by being that pump. To achieve this, you need to push the chest at a depth of 5 to 6 centimeters. So we've got to that stage now where you're going to have to do some work. So how do we actually do chest compressions? So you need to be on your knees as close to the casualty as possible. Place the palm of your hand on the center of their chest, on the sternum. You can feel it on yourself. It's the hard bone in the middle that connects your ribs. On a male, if you were to draw a line between the nipples, the center of your palm would be directly over that line. Place one hand on top of the other. It really doesn't matter which way round, whatever is most comfortable for you. You need to get up tall, lock your arms out, because you're not using your arm muscles to do these compressions, you're using your body weight. As I've said, this is hard work. So get as tall as you can, lean over and lock those elbows out. Now you're going to need to start the compressions. Remember, it's 5 to 6 centimeters in depth. The rate you're looking for is about 100 to 120 per minute. For those of you who remember the songs, the Bee Gees song, Staying Alive, that's the beat, or Nelly the Elephant for the younger people. So in this scenario, you're the only rescuer on scene. So when do you stop? There's only actually 3 reasons you stop. The first one being that the patient makes a purposeful movement, in which case you then come off the chest, reassess and go from there. The second one would be that a medical professional has arrived and they've said thank you for your help and asked you to step aside. But remember, do not stop just because the ambulance arrives outside. They've got to come in, they need to get their equipment out, and they're going to probably still need your help. The third reason is that you are literally so physically exhausted you just can't continue. But hopefully we won't get to that stage. Okay, so let's go over what we've learned so far. We've gone through a patient assessment. You've done your doctor's A, B, C. You've called 999 and you've given them all of the essential, relevant information that they require. You've then started chest compressions, and you also know when it is appropriate to stop. So please remember, timing is everything. For every minute somebody is in cardiac arrest without intervention, their chances of survival drops by over 10%. So as you can see, by you initiating chest compressions as early as possible, you really are giving them a fighting chance. In our next film, I'm going to show you how to use an AED, also known as a defibrillator. So please click on the link, How to Use an AED, and we will give you all the information and show you everything you need to know.